At age 70, the mayor says he'll spend 2 weeks undergoing intensive behavioral therapy in a residential center. Here with perspective on treatment options is clinical psychologist Jeff Daly. Jeff, welcome.
Oh, thank you so much.
So after 7 accusers of sexual harassment and misconduct come forward, the mayor admits to not respecting women. How does his behavior, or I should say, what does his behavior suggest?
His behavior suggests a few things. One is that he may have very outdated traditional views of men and women. And of course, that's not enough because many people do and they don't behave in that way. The other thing is it tells me he may lack some empathy, he may lack some remorse, and he may objectify and even dehumanize women. And these are characteristics of people that have personality problems. These are characteristics of people that change is difficult, even when you're in treatment. So these are some real concerns.
Let's talk about this treatment. What is behavioral therapy?
Behavioral therapy is a very general term, so it's non-specific at this time. What it means basically is you have an undesirable behavior. We want you to have a healthy behavior. That's it. We don't know anything else. And so that's probably going to not be enough. So really, we need to work with his thinking, his perceptions, his thoughts, his feelings, not just his behavior. So whether he goes to somewhere where he lives there for a week or 2 weeks, or he goes a few times a week, like at an outpatient level, it will be intensive. So hopefully he'll be doing individual therapy, he'll be doing group therapy, he'll be going to meetings, maybe even 12-step if he's entering into an addiction kind of facility. But it should be intense enough to where his treatment is all day long.
Okay. Does his behavior indicate some sort of sexual addiction or compulsion or a mental illness?
Yes. Yeah, it's all three. In fact, his behavior tells us that all these things could be what's happening. Really, the only person that's going to know is his treating doctor. And that's if the mayor decides to be honest with him. You can easily go into treatment and say the things that people want to hear. Yes, I need to be here. I know I need to be here. But unless he surrenders to treatment and really gets honest, then we may not know.
What if it's, and I've been hearing this quite a bit, if it's a personality disorder, it's not necessarily a medical diagnosis in the DSM-5. What if it's just simply a personality disorder? Are those treatable?
Yes and no. So can they get better? Yes, but there's a couple of issues here. One is he's in his 70s, and that means his personality is inflexible. It's pervasive, and change will be really difficult. And one of the reasons is not only does he have experience, his brain has stopped growing. I mean, that happens in your 20s. So real change is difficult the older we get. The motivating factor is he willing to change? If he does not want to change, he will not. If he is willing to change, that's the only thing that will get him to make any progress.
Basically, how would doctors or whoever's treating him get at the root of his problem?
That takes a while. So the root of the problem means we need the person to be honest. We need the person to chronicle all the different things that are in line with his behavior now. My personal feeling, and this comes from treating people with similar issues, tip of the iceberg. If we know about 6 or 7 people that have come out, that means that there are many other incidents and people and victims that have been involved in what we're talking about. So you have to get honest and you have to chronicle all these things. You have to go back to where it began. Sometimes we figure these things out in childhood. That's where they begin.
Well, he's said, he's going to be in this intensive therapy for 2 weeks. Is that enough time?
No, that's not enough time. I'm not aware of any treatment program that can guarantee a cure in 2 weeks.
Okay. He also said he's going to be working and going back to work after the therapy. Could there be triggers at work that maybe impede his treatment?
There will be triggers that will impede his treatment. And so that's part of what we do when we treat someone is we recognize that the treatment that you're getting now will not be enough. When you leave here, you're going to need ongoing consultation, ongoing treatment, because once that intensive treatment stops and you're on your own, all those behaviors, those thoughts and feelings, they're all going to come back. And you need to be aware of them.
Could he continue outpatient therapy, though?
Well, he should. Mm-hmm. He needs to. That's the thing. So again, there's no 2-week cure for anything. Once he's done with intensive treatment, the rule of thumb, enter into a lower level of care.
Could we expect to see any changes after the 2 weeks? Will there be some behavioral changes we might be able to recognize and see?
Yeah, that's what you will see. You'll see after 2 weeks, great behavior. And that's typically what happens, whether they want to be better or not. And what we'll know long term is then we'll see if there's real progress. But yeah, you'll see some good changes right away. But in 6 months to a year, that's when the real test will be.
To see if we can monitor. All right, clinical psychologist Jeff Daly, thanks so much.
My pleasure. Thank you.